Children are the key to our future. One of the most effective ways to get them off to a good start is to breastfeed infants exclusively for about the first 6 months. Breastfeeding is good for the health of both the baby and the mother. To promote breastfeeding, the World Health Organization and UNICEF launched the Baby Friendly Hospital Initiative. The U.S. designating authority, Baby Friendly USA, aims to get American hospitals baby-friendly designated. Hospitals can become designated when they accomplish 10 steps to successful breastfeeding, which include informing pregnant women about the benefits of breastfeeding, helping mothers to initiate breastfeeding within 1 hour of birth, feeding infants only breast milk, unless medically indicated, and allowing mothers and infants to remain together 24 hours a day. Progress is being made in the United States, and more mothers are breastfeeding longer. Even so, as of August 2014, less than half of all babies are still breastfeeding at 6 months, and only 8.4% of all U.S. hospitals have achieved baby-friendly designation. NICHQ, the National Institute for Children's Health Quality, with the support of the Centers for Disease Control and Prevention, and in close partnership with Baby Friendly USA, has led an initiative called Best Fed Beginnings. NICHQ has helped 89 hospitals across the country as they sought baby-friendly designation. It's the first nationwide program of its kind.
We know that hospitals are not providing optimal care in general, and this is a way for us to make that quality improvement so that moms and babies really can get the best start to life. Our hope is that the project will also leave behind kind of a legacy of the lessons learned for other hospitals of how they can go through a quality improvement process and improve their practices along this same pathway toward becoming baby-friendly.
This is the story of 2 of the Best Fed Beginnings hospitals. Greenville Memorial Hospital is a 710-bed tertiary referral hospital and academic center located in Greenville, South Carolina. Greenville is part of the largest health system in South Carolina and delivers approximately 4,700 babies a year.
This has been a real transformative journey for us, and that's something that really lines up well with our mission and our vision. Our vision is to transform healthcare, so we're not here just to leave things as they are. We really want to advance the cutting edge. And this is an initiative that really pushed us to transform the care up in the unit.
Truman Medical Center at Hospital Hill is a 272-bed acute care and outpatient hospital located in Kansas City, Missouri. Last year, around 2,000 babies were delivered here.
The importance of good nutrition starts at birth, and we feel at Truman that baby-friendly provides the family an evidence-based approach to infant feeding that has outstanding outcomes. So it fits with our mission and vision for providing a healthy community.
So this is our newborn nursery, and it's changed quite a bit over the last several years. As you will see, the only babies that are in here are babies that absolutely need to be here for a reason.
This was our public viewing window where people could come and see the babies. So we replaced our windows with these educational wraps. We used to have people come up and say, "Where are the babies?" You know, I mean, people from all over the hospital, and we'd have to explain to them. The babies are in the rooms with their moms. So we don't have them for viewing any longer.
Legs to your chest and push down. Pull and push.
Push it out.
Push. Push.
Keep it.
Push.
It's coming.
Yeah. Keep going.
Keep it coming. Keep it coming. Come on.
Look at you. Quick breath. Okay, one more time.
Come on. You can do it.
Deep breath in.
You can do it. You got it.
Oh my God.
How's the baby? How's the baby? Oh my God. How's the baby?
Keeping babies with their mothers starts from the moment of birth. In a practice called skin to skin, the baby is placed right onto the mother's chest within moments of delivery. In most cases, the newborn instinctively begins searching for its first meal.
We can remember in the old days when all of our babies went to the radiant warmer. Now all of our babies go skin to skin, whether it's a vaginal delivery or a C-section. It's our standard of care.
They gave me my baby, and the midwife that helped this along and birthed my baby showed me exactly how to hold him and how to hold his head, and tickle his lips with my breast so that I could get him to latch on and how to have him latch on properly. And it didn't take too many times until he finally got it right. And he did feed for a while, and so it was a great bonding experience.
We had many mothers who had no intention of breastfeeding when they walked through the door that ended up breastfeeding because the baby was skin to skin. Even teenagers who I would never expect to buy into breastfeeding were breastfeeding by the time they left here.
I have a little boy. He's about 5 years old. I had him here in the hospital, and I remember the experience was very different. When I had my son here, as soon as I had him, they did take him away and began to bathe him and check him. And this time, when I had my daughter, they gave her to me immediately. And I felt like the experience was more towards a natural birth, just like I wanted. And I really appreciated that they let me do the skin to skin and breastfeed as soon as possible.
You know, our nursery is so much quieter and calmer now than it used to be. We rarely see babies in isolettes anymore. And I believe that has to do with, you know, the immediate skin to skin and keeping babies with the moms. And so that's one of the things that has surprised me.
Achieving baby-friendly designation is a big commitment. It takes a lot of concerted effort and coordination to get all levels of the hospital to support the endeavor.
One of the barriers that we didn't anticipate was how much effort and time it would take to get the prenatal education piece in place for families. So important to teach mothers about breastfeeding, skin to skin, rooming in, and baby-friendly concepts before they deliver so that they're prepared when they come to the hospital. It took a long time to write the curriculum, to get buy-in from our obstetric practices, and to really implement the curriculum for pregnant women in our community.
Our OBs, it took a little bit longer, but now they have joined the journey as well, and it's just because, like any good practice, they want to know what truly is in it for the patient, and we had to prove that this was the best thing for our patients.
All of the staff we talked to said they found participation in NICHQ's Best Fed Beginnings initiative instrumental in overcoming challenges.
The support that was provided by NICHQ in the Best Fed Beginnings Learning Collaborative was invaluable. We had really been taking very small steps toward becoming baby-friendly for years and years before this project came along. It really took the collaborative to help us get the buy-in from our leadership that we needed. We couldn't join the collaborative until we had that letter from our CEO saying that he was behind the whole program.
We utilized many of the resources given to us by Best Fed Beginnings to help us do some of the education and training. We did a lot of networking with the other people in the collaborative, using the staff available to us from NICHQ to help us push on. They were a great cheerleader when we were having our low moments, and they helped keep us going and helped us stay on track to move toward the things that we needed to do.
All of the effort has been paying off. The Best Fed Beginnings hospitals have made huge improvements in their maternity care practices.
We've seen tremendous progress in the quality of care. There are a number of measures that we've taken with the hospitals, monitoring on a monthly basis what their rates of breastfeeding are, exclusive breastfeeding, what their rates of skin-to-skin care are, and what we've seen across the 89 hospitals is a dramatic improvement month by month of those rates improving across all of the hospitals.
On July 8, 2014, Greenville Medical Center received the results of their baby-friendly on-site assessment.
All right, everybody. Well, thank y'all for coming at the last minute. We have some news to tell you. We've heard from Baby Friendly, and they have given us the areas that we need to work on in order to be designated. And I wanted to let you know what those are. And there's none.
The project really has demonstrated that it's not just enough to know what the right thing is to do, but you really have to work through a process to figure out how to change your practices to really make that happen.
I'd say without hesitation, this is something you should go down the road to do. Again, primarily because it's the best thing for our moms and for our babies here. But as we found, the costs have been very, very minimal and the benefits have been really great.
You absolutely want to do this. It is the most rewarding thing, not only for the patients, but for the staff at a hospital. It's a win-win situation.